Hi friends, I'm Dr. Nikhil. I'm a consultant laser and laparoscopic surgeon with Pristyn Care. And in our last video, we already talked about the gallstone disease, the causes, symptoms, and the diagnosis. So now we will move ahead and talk about the treatment of the gallstone disease. As the treatment of the gallstone disease involves removal of the gallstones along with the entire gallbladder. What we call it as a cholecystectomy. Okay, so this can be done either by open approach or by laparoscopy approach. So in the open approach, here is the gallbladder, and we take an incision like this over the abdomen. So it extends from here to here, which is around 8 to 10 centimeters. And in the laparoscopy approach, we have a port at the navel where through which our camera goes in, and then we have another two ports, one in the epigastrium here and one here. Sometimes we may have a fourth port at this point. So your ports are here, 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 and if needed, here. These ports are very small, like keyhole incisions in the abdomen. Okay, and through this the camera goes in, and then this is my left hand, this is my right hand, and I dissect and get out the gallbladder through this port. Okay, now why should you get operated? You should get operated before you develop any complication of gallbladder. Okay, you may have a cholecystitis. So once you have here gallbladder stones, the wall of the gallbladder becomes thickened and inflamed, which is the cholecystitis. When you have the stones in this area of the CBD, then this area becomes inflamed but thickened. This is what we call cholangitis. When you have a large stone occluding the opening of the duct, then this gallbladder increases in size. There is accumulation of bile, which ends in the accumulation of mucus, which we call a mucocele, and then this mucus turns into pus, which we call empyema, and then this will eventually give way at one place, which is the perforation of the gallbladder. Then suppose if one of the small stones come down and get obstructed at this point, and then this pancreatic duct becomes inflamed, and the pancreas becomes swollen. So that is gallstone induced pancreatitis. And then it has also been associated with the cancer of the gallbladder. All the patients who had the cancer of the gallbladder, around 20% of them had gallbladder stones earlier in life. Okay, now why laparoscopic surgery? Laparoscopic surgery, as I already told you, lesser incision, small keyhole incision, less pain, better appearance of the abdomen after the surgery. You will be discharged early, either the same day or the next morning. You return to your normal activities the same day, and you are at home for around 2 to 3 days, and you are back to work after that. And since we have no major incisions, there are minimal chances of hernia at the incisions also. Thank you.